80% of monitor alarms, silence that, thank you. Okay, let's try this again. Research shows that roughly 80% of monitor alarms, just ignore that. Research shows that roughly 80% of monitor alarms are not accurate. These false alarms are a serious problem for everyone caring for patients in the acute care setting. Working in an environment with constant sound of alarms can cause the healthcare team to become desensitized to their meaning and their validity. This phenomenon has been coined alarm fatigue. Alarm fatigue is said to lead to decreased sensitization and actual response times in emergencies. It has been correlated with sentinel events, including patient death. There are several emerging interventions to combat this phenomenon, including utilizing disposable leads, changing the leads daily, and individualizing parameters for each patient to accommodate their clinical picture. Our research question is, in hospitalized patients requiring continuous monitoring, does routine electrode replacement and individualizing monitor parameters reduce false alarms and improve patient outcomes? Today we will discuss our findings on this topic and what we feel our next steps are to initiate a call to action.
An important part of the research process is knowing what resources are available and how to correctly and efficiently utilize these search engines. For our specific research question, we were able to use our school library database to find supporting evidence. I will now go through and demonstrate how to navigate this resource. Okay, so first you're just going to go to your preferred web browser. For this example, I'm going to use Firefox, which I already have up. Our school was gracious enough to pay for our access through the library, so I have it bookmarked here, but you're going to want to access the Swilly library. Then you will go ahead and click on databases. Now I do of course have to log in using my school ID. So I'll go ahead and log in. From there I can click on databases and you'll get an alphabetized list here. For this initial example, I'm going to go ahead and use CINAHL because that was what we found extremely helpful in our search. So this is also alphabetized. So I will click on CINAHL. This was extremely helpful because it was specifically nursing and we knew that we needed our articles to involve a nurse as an author. So then your search fields will pop up. I will just type in alarm fatigue because that was our first topic. And before I get into any of these other inclusion or exclusion criteria, I'll do the initial search. So when I do the initial search, you'll see that 120 articles come up with the word alarm or fatigue in it. Now I want to limit that because of course we're not going to go through and read 120 articles. So you can see that you have refined searches over here and you can use Boolean phrases. So those are the phrases that you want to add on to alarm fatigue. You can also do full text. If the publication date, of course, we want to limit it to 5 years so that it is relevant. And then you can click on show more. And then this is that initial page that we had. So I will go ahead and click on some of these that I want to limit a little bit. Let's just say 2011 to 2016. We do want it peer reviewed, so you'll click on that. We want it English language because that is our language. Any author is a nurse is also extremely helpful, and let's go ahead and do that and see what those results come up with. So now instead of 120 you can see that we only have 11, so that's much more manageable to see if any of these articles are actually pertinent to our topic. And then once you find one of those, you can click on it and read through the abstract and see if that's something that will be beneficial to your topic. So from this homepage, which you can see CINAHL, that was what we just used. I'm just going to go through some other databases that our group found extremely helpful. We also use Galileo, so of course this is still in alphabetical order, and you can click, we use Galileo Advanced Search because it has the fields that we want to be able to set our criteria. And again, you can see your search fields and your Boolean terms. Another really helpful thing that Galileo has is you can click your discipline here, so you can see nursing and allied health. And then it's going to be essentially the same criteria as what we did for Cinol. So you can click the full text, you can limit your published dates, we want it to be peer reviewed, and then you can limit your searches that way. So from Galileo, we are going to go back to that homepage. It's nice that it opens up in a different tab so that you can just go right back to your homepage. Another one is Ovid. So if you go ahead and click on Ovid, and wait for it to open up. I'm just going to click on Journals full text because that is essentially what we were looking for. And then you can see up here this advanced search. So if you click on the advanced search, again, it's going to be a lot of the same search criteria that we used before, but it's just laid out a little differently. So you can click on nursing and within the last 5 years, and type in your keywords, and then you can search. And lastly, we're going to talk about PubMed. So you're going to click on the P and go all the way down to PubMed, and I'm going to talk specifically how I found one of the articles that I used. So I'll click on the advanced so that I can limit it a bit. And initially I started with just typing in alarm. And that yielded 8,012 articles. That wasn't helpful. So I went ahead and tried to do another search, and I typed in alarm and then cardiac because that was more specific to our topic. That still gave us 616 articles. So over here you can see how you can further limit those. So I want to do full text. I want to limit the years to 5 years so that it is relevant. And then you can click on journal categories. So of course I want it to be a nursing journal. And then from there you can see how it went down to 9. And then I was able to go through these articles just because it was 9 and that was more manageable. And I actually found this novel approach to cardiac alarm management on telemetry units. And I clicked on that and I was able to read the abstract here and see that there was in fact a nurse author, and I knew that this was going to be a very helpful article to support our topic.
In our research project, we included a findings table to summarize all of our research articles used. So this table includes the author, some important variables, the hypotheses of each article, the design of each article and the sample and setting of them, and some important findings that we wanted to include, as well as important notes. So in our research, we included some quasi-experimental studies, a few literature reviews, and mainly observational studies. So one article we included in our research by author Bridie was a quantitative observational study from an 88-bed ICU unit in Brazil. This author mentioned that patient safety is compromised due to decreased reliability of monitors causing alarm fatigue in nurses. During the 40 hours of observation on this unit, 227 monitors alarmed, but 145 of them were either not responded to by the nurses or they were responded to in 10 minutes or more. The median reaction time was 4 minutes and 55 seconds to the 82 alarms that were answered in under 10 minutes. Our group also included an article by Wayland that observed and documented findings from a 24-bed Mercer unit in Boston. This research showed an 89% reduction in audible alarms and a 50% decrease in incidence of code blues. Lastly, a research article by Albert discussed a cluster randomized controlled study completed in the U.S. where 1,200 beds had the option to be chosen for the study. Research found that 80% of disposable lead alarms are false and 83% of reusable lead alarms are false. In a report from the study, nurses were the responders to only 46.8% of all EKG alarms, which we can contribute that to an abundance of false alarms, thus promoting alarm fatigue in nurses.
We chose one article specifically to appraise from 2012 by the author Chavak, who asked the question, does changing electrodes daily decrease the quantity of cardiac monitor technical alarms? Essentially, this article used patient populations from 2 units in a United States hospital to study a baseline of alarm rates. The researchers then determined the rate of alarm occurrence after introducing daily electrode changes and skip prep prior to applying them. Nurses and techs were trained on specific skin prep methods as well as daily changes between the specific hours of 8 a.m. and 12 p.m. each day.
Now we'll discuss the individual steps of the appraisal process. The first section is about credibility. Is the study published in a source that required peer review?
Yes. It was stated that it was published in the Journal of Nursing Care Quality. It is also stated it is used by Walter Kluwers and by Lippincott.
Was the design used appropriate to the research question?
Yes. The design used was quasi-experimental. This was appropriate because there was an intervention that was going to be tested to see if the number of alarms would decrease. The design was able to support the cause-effect relationship of these interventions, reducing the less relevant alarms.
Did the data obtained and the analysis conducted answer our research question?
Yes. The data collected was used in determining the results. The data was presented in the form of percentages showing the increase or the decrease of the alarms before and after the interventions.
Were the measuring instruments reliable and valid?
This one was not as clear. See, both units had the Solar 8000i monitors. However, these monitors did not undergo the Kronesbach alpha test to determine the reliability or the validity.
Were important extraneous variables and bias controlled?
This is something else that wasn't too clear. See, the staff was given proper training before the new electrode replacement and were told to follow the hospital's protocol for applying these new electrodes. However, the researchers did not clearly state how or if they controlled these extraneous variables.
Did you feel the groups were treated equally other than the difference in the interventions?
Yes, absolutely for this one. So there were two groups, one part of the MPCU and the CCU. Both groups were compared at baseline levels before these interventions, and then during the interventions, the procedure for applying the new electrodes was done during a set period of time in the morning and had specific instructions how to prepare the skin of the patient. Both sets of staff were explained by the nurse manager how to do the procedure. Both units also had the same Solar 8000i monitors.
So was the study free of extraneous variables introduced by how, when, and where the study was done?
This is something that wasn't that clear either. The study didn't mention if there was any inclusion or exclusion criteria, nor was the random sampling used to reduce the chance of bias. In addition, consistency of the same healthcare workers throughout the study was not mentioned. So one may have a different method of applying electrodes than someone else. We're not sure.
Were participants randomly assigned to groups, and were the two groups similar at the start before you gave the intervention?
No, they were not randomly assigned to groups. The study used 2 convenient samples of complete units.
Were the interventions well defined and consistently delivered?
Yes. The charge nurses on the 2 units taught the technicians responsible for the electrode changes how to properly apply them during the 8 a.m. and 12 p.m. time frame. They also taught them how to properly prep the skin prior to applying the leads by shaving the area, rubbing the skin to remove dead skin cells, washing the site with soap and water, and then completely drying the skin.
If a difference was found, are you confident it was due to the intervention?
Yes, a difference was found. On the Medical Progressive Care Unit, the baseline total electrode-related alarms was 1,336, whereas there were only a total of 904 electrode-related alarms post-intervention, thus a 32% decrease in alarm occurrence. For the cardiology unit, the baseline number of alarms was 1,836, and then 816 after the intervention. So we see a 56% decrease on this
Are the
unit.
findings consistent with findings from other studies?
Yes. All of the research articles we included mentioned the same interventions to reduce the false alarm occurrence, while also showing improvements from baseline to after promoting the intervention.
Okay, so now we're going to move on to the clinical significance portion of the appraisal. Note any difference in means, R-squared, or measures of clinical effects like ABI, NNT, RR, or OR.
No, we need more research to be done, specifically randomly controlled trials.
Is the target population clearly described?
Yes. So one of them was a 15-bed medical progressive care unit, and the other one was a 25-bed cardiology care unit. This was more of a step-down critical care unit. Nurses and techs who worked on the 2 units were taught ahead of time what time frame to change the leads, as well as the proper method of when to apply them.
Is the frequency, association, or treatment effect impressive enough for you to be confident that the finding would make a clinical difference if used as the basis for care?
Yes. The dramatic difference in the baseline and intervention alarm rates gives us confidence that this would make a difference clinically, thus eliminating false alarms and alarm fatigue in nurses.
Now Now we're going to talk about the synthesis of our evidence. The level of evidence we used for this topic included A2, B1, C1, and D. Unfortunately, because this is such a new topic in healthcare, we could not locate any A1 level evidence, which would include systematic reviews. When reviewing the evidence we did collect in our research, we found consistent results. The results of the research show a decrease in total alarms overall. Specifically, clinically irrelevant alarms were reduced when the interventions were applied. In the observational studies that we used, it was found that over 50% of the alarms were either not responded to or took the staff an extended amount of time to address. This resulted in lower quality of care of the patients. When applying interventions such as daily electrode changes, individualizing alarm parameters, and proper electrode placement, the total number of clinically irrelevant alarms decreased dramatically. The clinical interventions implemented in these studies on the alarms resulted in better patient care and nurse satisfaction. The reduction in excessive false alarms decreases alarm fatigue in nurses and increases the likelihood they will be more attentive to the critical ones.
That randomized controlled trials are lacking when it comes to evidence-based research on this topic. Our group would institute a randomized controlled trial in order to evaluate the effectiveness of the interventions on reducing alarm fatigue and unsatisfactory patient outcomes. Some specific interventions we would implement would be daily lead changes and individualized monitor parameter settings. We would select an intensive care unit where alarm fatigue is common and use power analysis to ensure an adequate sample size, along with clear inclusion and exclusion criteria. From there, we would randomly divide the participating patients into two groups. One group would receive the interventions, while the other group would continue to receive standard daily care or hospital protocol. After a predetermined amount of time, we would gather the data, analyze it, and determine if a reduction in false alarms and a decrease in alarm fatigue were reported by the nurses. The goal would be to conclude that the results are clinically significant, statistically significant, and the two variables were positively correlated. We would also set a p-value to ensure that the findings were less likely due to chance. A great way to disseminate this information and get buy-in from the staff for this particular design project would be to host a lunch and learn. We could invite the unit nurses, unit manager, charge nurse, and other central office personnel to share our findings, dialogue with us, and have a question and answer session. It is extremely important to get active participation from all support staff in order to institute a successful implementation of a randomized controlled trial. As mentioned, since this is a newly recognized healthcare issue, it was difficult to ascertain an adequate amount of high-level evidence to support our group's interest in this topic. Despite the lack of significant and valid evidence, our passion for this issue and the need for further research are vital to the safety of our patients. Joint Commission has made alarm fatigue a national patient safety goal. Since Joint Commission has officially acknowledged alarm fatigue as a considerable threat to patient safety, it is vital that more studies are conducted on this topic, including randomized controlled trials and systematic reviews, in order to establish a baseline for potential evidence-based clinical guidelines and hospital protocols.